Upstate Medical University in Syracuse, New York, is home to the Center for the Diagnosis, Treatment, and Study of Velo Cardiofacial Syndrome. The director of the center is Dr. Robert Sprinson, who was the first to identify VCFS is the most common syndrome after Down syndrome.
Okay.
Unless you have it, you've probably never heard of it.
And see what's happening, okay?
I'm Quinn Bradley, and I was born with VCFS. I first met Dr. Sprinson when I was 14 years old and returned periodically for follow-ups. Last March, I returned to
Facial syndrome is what we first called the disorder when we published it in 1978. Velo stands for velum, or the soft palate. It's the Latin term for soft palate. Cardio, obviously, for heart defects. And facial, because of a characteristic facial appearance. Not an abnormal one, just a characteristic one. We know that the syndrome is caused by a 40 genes. So there's a contribution of multiple genes to a wide range of abnormalities. And so far, we've documented over 180 of these problems, though no one individual has all of them. In fact, it would be unusual for a person to have more than 20 or 30 of them. The most common findings associated with the syndrome would be congenital heart disease, which we see in about 70% of cases. We see vascular problems of one type or another in almost all cases, and either some type of learning disability or even some psychiatric problems in nearly all cases associated with the syndrome. Because we have so many different findings in the syndrome, there's more than one treatment, and so very often we are treating individual components. For speech problems, we're dealing with a combination of surgery and speech therapy.
You're doing just great, honey, all right? You might. We're in the millions now.
For some of the learning issues or psychiatric issues, then we're dealing with medications.
When I was growing up, I was frustrated that people couldn't understand me, and I was sick all the time. It was hard for me.
We didn't know what was wrong with Quinn. He was 14 years old. He had had a myriad problems. I mean, we had the heart thing, he had epilepsy. He did, just like every week there was something that was going wrong. They told us he had cancer. I mean, it was just a nightmare. And one of the people who was a speech therapist at Children's Hospital called a friend at NIH and said, we've got this child here who's got all these problems, and it just something new crops up every week, and we're all going crazy. And the woman Sprinson in New York. And he walked in the room and Sprinson said, he's got it. I mean, even before we did blood tests.
People who have VCFS tend to resemble each other more than they resemble their own parents or siblings or cousins or other relatives. Quinn's speech problem was pretty significant at the time. He was not real happy about it, and nor were his folks. Because the syndrome has we were able to identify the syndrome as well as to identify the exact lack of muscle movement that required reconstruction.
A lot of people are devastated when you find out your child has some syndrome that's serious. I was enormously relieved because it explained everything to me, all of the terrible things that had been happening to Quinn since he was born. Suddenly, there
required a pharyngeal flap operation. Pharyngeal flap surgery is a reconstruction of the back of the throat so that if too much air is escaping through the nose during speech, we can block it off effectively. and normalize the speech pattern, the voice, the resonance, and then also if there are articulation problems and other speech problems, we treat those with speech therapy.
Worries about is, will that child be able to take care of himself or herself when we're gone? And that was our worry. And Sprinson really made us believe that Quinn could take care of himself and would lead a happy and productive life. We had been told that he would be institutionalized when he was 8 years old, that he would never go to high school, that he would never have a job, that he would never have friends.